recommend that all new patients undergo preconception expanded carrier screening. That's a mouthful, let's break it down. So preconception means before pregnancy. Expanded carrier screening means to get a blood or saliva test done that can test to see if you are a carrier for a panel of diseases. Now, these panels have become very sophisticated and commonly include well over 200 diseases, and these diseases typically are inherited in an autosomal recessive manner, which means in every individual there are 2 copies of a gene. If you have 1 copy that's abnormal, but 1 normal copy, then you are considered a carrier, but you are unaffected with the disease. In diseases that are inherited in autosomal recessive fashion, like cystic fibrosis or spinal muscular atrophy, if one individual has a baby with an individual and both are carriers for a disease, then the individual offspring has a 1 in 4 chance of having a disease. So having preconception carrier testing identifies if a couple is at risk of having a child with a disease that could result in a life-threatening condition. Approximately 2/3 of individuals will have a positive carrier screen, and that's very common, that's normal. It's important to identify, though, the 0.2% of couples who both carry the same mutation. For instance, one individual may be a carrier for disease X, but her partner carries disease Y. That couple will not be at an increased risk of having a baby with those diseases because they are carriers for different diseases. Doing preconception expanded carrier testing allows us to identify your potential risk for having a baby with an inherited disease. Now, these panels are not all-encompassing or all-comprehensive. They do screen for the most common diseases, but they do not completely eliminate the possibility of having a genetic abnormality in a baby. They do, however, markedly reduce the incidence. Preconception expanded carrier screening is important because it can help us identify couples who are healthy but at risk for having a baby with a disease like cystic fibrosis or Tay-Sachs disease. And we can then tailor our fertility plan based upon those results if needed.